completion of human reproduction, today we are going to deal with the reproductive health. Okay, so here in this we can see a synopsis or mini introduction is in this lesson what we are going to learn. First thing, reproductive health problems and strategies. So related to the reproductive health, what are the problems and what are the strategies are using by the persons or the governments that we need to understand. After that, population explosion and birth control. After that, medical termination of pregnancy. Next, sexually transmitted diseases and what is infertility. Okay, so all these things we are going to learn in this lesson. See, reproductive health. So, what do you mean by reproductive health? Mainly, we need to define it. The term simply refers to healthy reproductive organs with normal function. See, reproductive health only we can define it in a simple words. Healthy reproductive organs with normal functions. That's it. It is called as what? Reproductive health. However, it has a broader perspective and includes the emotional and social aspects of reproduction also. See here, along with this reproductive organs and processes, we need to have a balanced or healthy emotional and social aspects too. According to the World Health Organization WHO, reproductive health means a total well being in all aspects of reproduction. See, means what? If a person is healthy, reproductively healthy means he or she need to be healthy in all the aspects. It may be physical, it may be emotional, it may be psychological. Okay, it may be a mental. All these things, all the aspects need to be a well-being, such as physical, emotional, behavioral, and social. Therefore, a society with the people having physically and functionally normal reproductive organs and normal emotional and behavior interaction among them in all sex related aspects might be called reproductively healthy. See here, in all the aspects, a person need to be a healthy. In what aspects? Physical, emotional, social, mental. All these aspects, a person should healthy. Then only that person can be said as reproductively healthy person. Why it why is it significant to maintain reproductive health and what are the methods taken up to achieve it? Let us examine them. First, reproductive health problems and the strategies. See, what are the problems related to the reproductive health as well as what are the strategies are used by persons as well as the government. See, India was the amongst the first countries in the world to initiate action plans and programs at a national level. See, to attain total reproductive health as a social goal. See, India is first in this program, we can say. Why it is first means these programs called family planning. First, they have initiated. Indians only initiated the family planning. Were initiated in the year 1951. It is initiated in the year 1951 and were periodically assessed over the past decades. See, and it is also assessing in a previous or past decades. Improved programs covering improved programs covering a wider reproduction related areas are currently in operation under the popular name Reproductive and Child Health Care. See, RCH. It is one of the operation going on in India named as Reproductive and Child Health Care Program, creating awareness among people about various reproduction related aspects and providing facilities, and support for building up a reproductively healthy society are the major tasks under these programs. See, these are the programs which is, we can say, trying to take some of the steps to help the needy persons like women and children. They need to know about the reproductive and child health care programs. Okay, see, with the help of audiovisual and the print media, governmental and non-governmental agencies has taken various steps to create awareness among the people about reproduction related aspects. See, here we can use the audiovisual things as well as print media. Both the types of peoples like government or non-government peoples, they are doing this. Okay, parents, other close relatives, teachers and friends also have a major role in the dissemination of the above information. See, some of the close relatives, friends, family, these are also involving in these programs. Introduction of sex education in schools should also be encouraged to provide right information to the young so as to discourage children from believing in myths and having misconceptions about sex related aspects. See, whatever the myths kids are going to generate or they are going to form in their brain, they need to be removed. That myths need to be removed with the help of sex education in their school only. See, proper information about reproductive organs, adolescence, and related changes, safe and hygienic sexual practices, sexually transmitted diseases, AIDS, etc., would help people, especially those in the adolescence age group, lead to a would help people, especially those in adolescence age group, to lead a reproductively healthy life. Educating people, especially fertile couples and those in a marriageable age group, about available birth control options, care of pregnant mothers, postnatal care of the mother, and child importance of breastfeeding, equal opportunities for male and the female child, etc., would address the importance of bringing up socially conscious, healthy family of desired size. See, we can say the major thing with this we can do is we can control the population by creating awareness among the adolescents and whatever the things like sexual health, sexual practices related to the hygiene and STDs like AIDS, gonorrhea, all these things we can avoid with the proper knowledge. Okay, and giving equal opportunity to female child as well as male child. Okay, here we can say awareness of problem due to uncontrolled population growth, social evils like abuse and sex related crimes, etc., need to be created to enable people to thus to think and take up necessary steps to prevent them and thereby build up socially responsible and healthy society. See, if we are doing this, we can say we are creating the socially responsible persons and preventing the social abuses like rape, sexual harassment, all such things, we can control it. Successful implementation of various actions plans to attain reproductive health requires strong infrastructural facilities, professionals, assistance, professional expertise, and material support. These are essential to provide media expertise, media assistance and care to people in reproduction related problems like pregnancy, delivery, STDs, abortion, contraception, menstrual problems, infertility, etc. These all aspects we need to give the guidance on all these things. Those who are in a adolescent state and all. Okay, and along with the expertise, consultation, and media help, we can go through this. Okay, implementation of better techniques and new strategies from time to time are also required to provide more efficient and assistance to people. Okay, see, up to date we can say we need to update ourselves on whenever it is required. Okay, and we need to implement the better techniques which is like mass media and all such things whenever it is required. See, statutory ban on amniocentesis for sex determination to legally check increasing menace of female feticide, massive child immunization, etc. are some programs that merit mention in this connection. In amniocentesis, some of the amniotic fluid of the developing fetus is taken to analyze the fetal cells and dissolved substances. This procedure is used to test the presence of certain genetic disorders such as Down syndrome, hemophilia, sickle cell anemia, etc. It is used to determine the survivability of the fetus. See, here what is going to happen, amniocentesis is one of the technique which is temporarily banned in India. Why means with the help of this the peoples are detecting the gender of female fetucides and it is going to terminate. Okay, but it's mainly it is required or how it is performing means some of the amniotic fluid from the developing fetus is taken out to analyze the fetal cells and dissolve the in substance. Then this is mainly done to detect the genetic disorders such as Down syndrome, hemophilia, sickle cell anemia, etc. And also it is used to determine the survivability of the fetus. Research on various reproduction related areas are encouraged and supported by government and non-government agencies to find out new methods and or to improve upon the existing one. Do you know that Saheli, a new oral contraceptive for the females, was developed by a scientist at Central Drug Research Institute, that is CDRI in Lucknow. Okay. Better awareness about sex related matters, increased number of medically assisted deliveries and better post anal care, leading to decrease in maternal and infant mortality rates. Increased number of couples with small families, better detection and cure of STDs, and overall increased medical facilities for all sex related problems, etc. All indicate improved reproductive health of the society. See, with the help of this Saheli, it is one of the oral contraceptive pill which is created by the scientist at Central Drug Research Institute, that is nothing but the CDRI in Lucknow. It is what it is for the better awareness sex related matters. See, and due to medical techniques, see, means medical assisted deliveries, the number of mortality of mother as well as fetus is decreased. Okay, and the couple with the small families, that too without any STDs, is increasing due to this, and all indicated improved reproductive health of the society. So next we need to move for the next topic in the next class, in the next video or next streaming. So make sure to like, share and subscribe to my YouTube channel, and don't forget to hit the bell icon. Till that, if you have any doubts, any video if you want to make from me, means you can comment me in the comment section. Okay, I'll meet you in the next video. Till that, Allah Hafiz wa Miyad Rikna.